Okay, so welcome back. This is video number 2. In this one, I'm going to be starting an IV on our makeshift arm. For that, we've got all of our equipment gone over. Let me clean my hands. I've taught you or explained most of this equipment here. So let's get started. First, hands are clean. We're going to throw some gloves on. All right. My garage glove, so bear with me. Okay. So, got our gloves on, we've got our arm. Let's go ahead and throw our tourniquet on, right? And it's the patient's arm, so we're going to throw it above where we're going to be working, right? Okay. So that's how the dog ear's here. This is the release line, right? So we're going to go for this one. Which vein should I go for? I like this one. This is a nice juicy one. It's nice and pliable. So the best I could do as far as getting close to vascular access is we've got IV tubing here. There's no sheet or anything like that. Suppose if I wanted to, we could throw a glove over top of that to simulate the skin, but y'all get to that whenever you try it on your own. Okay, so first thing we're going to do is we're going to clean it. We've picked out our spot. So we've opened up our IV kit. We have our Tegaderm, so we need close by. Got our tape just in case. Like that. We got our 2x2s in case we need those. We make a mess. Got our IVs, I think for this one, just so you guys can see what's going on. I think we're going to go with the 16. It's going to be more difficult to go through this with a 16 because the size of it, but at least you guys get the idea of what we're doing, right? Okay, we also have our lock. This one, we're running out of juice on our lock, or our flush. So let's use this one. And again, I don't have the lock, but you guys have already seen what it's supposed to look like. So we're just gonna go with the flush and the extension for now, okay? Put that over here for now. It's gonna have the little blue thing on there to keep it clean and all that. We've already wiped down the hub of the lock for cleanliness as well on that one. Okay, so I think we're ready. So I'm gonna go ahead and we're gonna use our alcohol. We're gonna grab our patient's arm. We're gonna secure it because when we do this, almost all of them, 9 times out of 10, they'll pull just a little bit. Some of them will pull a lot of it, depending on. But so the back side of the hand and the palm, you're controlling where this arm is going. This one, you're actually holding pressure right there, tamponade, so you don't have wiggly veins. Without and with. Okay, so we're gonna go ahead and clean our site, starting at the center, working our way out. 5, 10, 15, 20, 25, 30. You guys know how to count to 30. No big deal there. You understand it. Okay. Are we ready? Okay. Peel back our wrapper. We've got our 16 gauge needle. Okay. Here we are. Bevel up. Always bevel up. Apologies for not wearing my NSC scrubs. But this is food coloring, and I have no idea what it'll do to my NSC scrubs. I know how to get blood out. I don't know how to get food coloring out. So, 15 degrees, right? And for the record, we've already cleaned that. Now we've got to clean it again. We're not cleaning it. You guys saw how to clean it. So, we're going to go ahead and, that's been cleaned. We're not touching it no more. We're not touching it after it's been cleaned. So, 15 degrees, go ahead and put it in. Some pressure on that one. We've put it in. We've got our little flash right there. I don't know if you can see the little pink there. And the food coloring sprayed all the way up my arm. So we've got our flash. So now we're going to hit this little hub with our finger here while we're still holding there. We're going to just slide that hub right up to the catheter right up there. At the same time, our needle is now out. Right? So with this free hand, now that we've let go of that, free hand, we can go ahead and pop that off, put it over here. We're going to hold onto the needle and continuously hold onto the arm. Now we're going to go above and we're going to clamp off that vein. So hold pressure there. You're going to twist. Sometimes it takes a twist to get that off. You've already got that locked in there, so you can't stab yourself. You're holding pressure so the blood doesn't come out there. You take your extension in your lock and your flush, and you hook it up. Now, at this point, you can go ahead and relax on the grabbing it. Still, make sure you know where it's at, right? That you don't want them pulling, because if they pull it away, you've lost it. But also, drop your sharps in a sharps container. Like I said before, the thing that we're getting away from a lot, we need to do more often, is drawback. Did you see that? We got blood out, so we know we're in the vein. So we're gonna go ahead and flush it. We're gonna flush it with 3 mils. Boom, we're there. So if I had a lock here instead of just this, we could go ahead and disconnect the flush, but because we don't, we're just gonna leave that on there, pretend that's a lock, okay? And we're going to take our 4x4s, and we're gonna clean up the area, because our Tegaderm patch isn't gonna hold very well if everything's wet from food coloring. Okay, then we're gonna take our Tegaderm patch, and we're going to apply this, where? To the hub, not to the lock, right? Or not to the extension tubing. Then we're gonna pull this off. There, that is secured. At this point, if we wanted to, we could throw a piece of tape up here as well to hold that. I would suggest it to hold on to the flush right there. I'm sorry, not the flush, the lock that would be right there. And with these Tegaderm patches, it's awesome. You can just throw your, right there, okay? And you've already labeled that with your time, your date, and your needle gauge. So you're in. That is secured. And if you didn't do the Tegaderm patches, you could also write on tape or paper tape. And you have now started your IV. Congratulations.